Good afternoon, everyone. Welcome to our seventh session of the Survivor is Profit series. My name is Ashley, and I will be your moderator for today. First of all, thank you for joining us today. Let me remind you again the purpose of this series. Survivor is Profit series is specially created during this challenging time for us to be able to help SMEs business by sharing what we know as industry experts and be able to answer the question you might have or the concern related to your business about today's topic, which is the digital future of healthcare. Most importantly, the objective is to give you values and tools to survive in this new climate. Live session will be conducted regularly in a series with different topic coverage and different speakers and panels. Speaking of which, we have three very highly distinguished speakers with us today. I will introduce to I will introduce them one by one to you all. First, I would like to introduce Ms. Gita. She has extensive experience in handling all aspects of trademarks and designs in various industries, including the pharmaceutical, F&B, property development, automotive, and apparel industries. Ms. Gita also frequently shares her IP expertise in BFM 89.9, Bernama TV, and has contributed articles to various local and overseas publications. Ms. Gita is also a business strategy coach with 10x CEO Coaching Group and empower entrepreneurs with knowledge, skills, and tools to create breakthrough organization results. Hi, Ms. Gita. Thank you so much for
Hi.
spending your time with us. It's our
Hi, Ashley.
honor to have you in our series.
Honor for me to be here as well. Thanks a lot, Ashley.
Thank you. Thank you for accepting our invitation. Last but definitely not the least, let me invite our third speaker for today, our founder and CEO of PanPages Trinity, Mr. Christopher Ng. Welcome.
Hello, guys. Good to be back for our seventh session, I think, of our
Yes.
Survival is Profit series. Thank you, Gita, and for being able to spend some time with our audience, our Trinity 42 community, which is tuning in all around from Malaysia, Vietnam, and Thailand, and Cambodia as well,
Yes.
mostly in Malaysia. Um, Thank you so much again for coming into this forum today. Um, we've been getting a lot of demand and inquiries about what are the best practices and how do people in the healthcare sector pivot through. And because of I think the midst of during this pandemic, this COVID-19 pandemic, the MCO or circuit breakers in whatever country that you're in, there's this huge surge in terms of activity in the healthcare sector. And we believe that there's also the pros and the cons. There's also a lot of noise amongst all these healthcare providers, or whether you are in the supply, whether you are doing services, whether you're product based, whether you're consumables. It's all still the same issue, whereby there's too many options out there now, and there's a lot of fear in terms of falsified brands or fake brands or fake products and services. So I think it is very timely for us to address this with the market. And thank you again for coming on board and help our SMEs in Malaysia, Vietnam, Thailand, and Cambodia. Hopefully they can get a thing or two today.
Yes. Thank you for being here on our seventh session of the Survivor is Profit series. I know that our audience is very excited to have such impeccable session for today. So make sure the audience you stay with us until the end of this session, yeah? For our audience benefit, let me briefly intro our agenda for today's session. There will be four parts for today. First, we will have Miss Gita to share with us about the current IP trends in healthcare. And then we will have Mr. Christopher to talk about digital marketing strategies and the best practice for the healthcare industry. And at the end of today's session, there will be Q&A session. Any question that you have, you may submit in the comment section. We will get our speakers to answer as many as we can later. All right. Without further ado, Miss Gita, I will pass over to you now. Hi,
Thanks,
Miss
Ashley.
Gita, over
Can
to
you see
you.
my slides? Can you see
Yes,
my slides
yes,
currently?
we can.
Okay, that's great. Second time lucky. Hi again, everyone. I'll be coming from the viewpoint of what are people protecting in terms of intellectual property. So, what are the IP trends in healthcare? A bit about CAS. So, we've been around for 21 years and we pretty much help people protect anything they create. So, when Chris was talking about healthcare industry, we looked specifically on what is being created in the healthcare industry. What are the trends? So, let's get started. Before I get quickly into IP in the healthcare industry, I wanted to address what is IP, what is intellectual property. So, intellectual property, easily explained, is property of the mind. It's the ideas that you have, which are then reduced to substance, and then you monetize them. So, in terms of healthcare, you're looking at all these diagnostic kits, you're looking at the huge rush to find a vaccine. Why is there a huge rush to find a vaccine? Why is US competing with China and Russia? The reason is exactly what the slide shows. Well, of course, no. There's also an altruistic reason behind it, which is to save all of us and to kind of set the world back to its original state where it's safe. A vaccine makes everyone feel safe, and we're not going around wearing a mask and keeping 1 meter away from everyone. But in addition to that, no company invests in research and development if they're not going to make a buck out of it. So there is a huge rush because the company that first finds the vaccine that is successful will be reaping the rewards. That's where intellectual property comes in. Intellectual property is an umbrella term for anything that you create that might be able to be protected. So these are patents. Patents protects technology, composition of drugs, diagnostic kits, anything that works in a specific manner. And that's new. That new discovery is patentable. Patent protection lasts for 20 years. Then you have trademarks, and these are brands. So look at the big brands in the healthcare industry. You're looking at Pfizer, you're looking at Novartis, and so on. Those are brands. Those trademarks belong to the company behind that. Trademarks last for 10 years, and you can renew them every 10 years. Then you're looking at industrial designs. Industrial designs is basically how the look of the product is, the 3D shape or the 2D ornament on that product. Some products might not have a patent, the technology might not be new, but the design might be new. So that's where the design protection becomes very important because they're using an existing technology, but they're being very creative with the way it's presented to the human, to us. Then you have copyright. Copyright protects artistic work and literary work. So that's pretty much the four main intellectual property rights. There are other rights as well. And let's see how intellectual property rights plays in the healthcare industry. All of you recognize this pill? It's okay to say if you do. We will not assume that you are taking the pill. So Pfizer has a very good strategy in how they actually monetize this intellectual property right. Initially, that composition of the drug is protected by patents. Any new drugs, the composition is new, so that can be protected by the drug or the pharma company. That patent that they have will last for 20 years in all the jurisdiction, all the countries they actually file the patent in. Viagra has all this patented drug has expired already. The 20 years has done. So right now you will find generic drugs for Viagra in the marketplace. Generic drugs are other pharmaceutical companies that use the same composition that was once patented and use a different brand on that product and they put it to the marketplace. They are not infringing any rights because the patent had already expired. But this is where intellectual property strategy comes in taking the business from here to here. See, in 20 years, drug companies know that their patents will expire. So this is where they look at how else can we have exclusive rights. They look at the brand. Viagra is their brand pretty much for life if they keep renewing it every 10 years. So they have the name Viagra. And in 20 years, when they launched the product, they kept marketing the fact that we all know it's the blue pill. We all know it's Viagra. Can you see how much of marketing has been done behind that? And that means when that patent and that technology has expired, they can still continue to reap the rewards from all that branding because people, the public, will still trust a brand that they know. They'll trust Viagra and they might not trust a generic drug with a different brand. So, can you see how branding is so extremely important in the healthcare industry? Even if they have technology, and they have a patent right. Viagra went one step further, Pfizer went one step further, and they also registered the industrial design. Many pharma companies, many supplements or drugs that you and I consume, they have a very standard shape. Look at the slide before you. It's a diagonal diamond-like shape. That shape is unique to Pfizer. They've protected that as well. And where possible, in some countries, they've protected the color blue for their drugs. So what they have done, what Pfizer has done in this example is they've used intellectual property rights to kind of carve out their personality and maintain their market share and ensuring that when people come as close as possible, they have ammo to shoot them down. The thing about copycats is copycats wait until a drug or pharmaceutical product or a medical device, a diagnostic kit is famous or is popular or is doing well, selling well in the marketplace. That is when copycats come in. Copycats have no money or time to spend on research and development. And that's where a lot of people in the healthcare industry suffer. Why is intellectual property rights important? Well, these are rights that when you have monopolistic rights, you can actually have premium pricing. That's why all these drugs will be initially higher priced, but compared to the generic drugs. So there's premium pricing. And think about it, right? Think of outside the healthcare industry, iPod and iPad. These were Apple's products that were brought in. MP3 player was already existing, and so was the tablet industry. When they come in and they revamp the design and user friendliness, they could do premium pricing on their products. It's the same thing in the healthcare industry. And then you can license your rights, you can franchise your rights, and you can cross license your rights or assign. Assign means you build something, you develop something, and you sell it. We actually had a client who had a diagnostic equipment, and he decided to actually sell that patent for a revenue. So that's another option in terms of monetizing your rights. All of this is only possible when you have monopoly. That's where intellectual property rights come in. IP rights are granted country by country, and there's a fixed duration. And these are exclusive rights. That's why a lot of pharmaceutical company focus a lot on intellectual property rights before they launch the products into the marketplace. All right, so now we come to some stats. Let's look at some trends in the healthcare industry. So the healthcare industry has gone shot up due to pandemic, really, due to COVID. And what has been the biggest trend is technology that's been changing it is very much in the ICT realm. So you look at AI and machine learning changing technology, the healthcare industry, robotics, computer and machine vision, wearable technology. This is a Fitbit. Many people say that it's also in the healthcare industry because it tracks your fitness level, and many fitness products can actually track your health as well, and it can send signals. Then you've got genomics, 3D printing, extended reality, digital twins, and 5G. Patent application trends. So patents are basically technology. So patent application trends, it shows that is technology being developed in healthcare, and this graph in front of you just shows that it's been going up and up and up. And you can see in 2020 it's a drop, but it's not really a drop. These statistics with technology can only be accumulated when the patent is published. But when I file or anyone files a patent application for 18 months, that information is not disclosed. Only when it's published, it's disclosed. So that's why that drop is there, but not because there hasn't been any patents being filed. It's that we can't extract the data yet. So you can see, and this is only going to be an upward growth. If you see what Tara said, that everything that people are searching for, people do not spend time on research and development if there's no demand. And Tara is coming from the demand. Look at what people are searching for. Everyone's so concerned about their safety. Everyone is so concerned about their health. The fact that searching is in that area, that then means research and development is also going to be going up in that arena. Let's look at which countries are focusing on technology, on R&D in this field. United States is hands down the winner in this. They've shot up in terms of 100,578 patents, applications, yeah? And then you've got India. You can ignore the second one, which is World Intellectual Property Organization. That's a international filing system. Then you've got India and China. So these are the big players in the market. I guess it's also because of population. If they find anything that's going to be relevant for their people, immediately they recoup their research, what do you call it? Returns on investment, right? You recoup your returns on investment. So you got US, India, China, Europe. EPO is Europe. Israel is doing a lot of research and filing a lot of patents. Then you've got Australia, Korea, Japan, and Singapore as well. So Singapore is heavily doing a lot of research as well. Top current owners, our IP trends find that, and this is really interesting, because the search that we did is in the healthcare industry. But look at who's coming tops. A lot of telco companies or electrical devices or electronics company are coming up top in terms of how they are doing research and development in this field or trying to integrate their products or their softwares into healthcare industry. So you've got Samsung as the leader in this market space. Then you've got LG Electronics, the regions of University of California. So a lot of universities also do research, and then they'll tie up with the private industry later on, private companies. Then you got Philips, and you have International Business Machines, which is IBM, Procter and Gamble company. So Procter and Gamble is a FMCG company, but they are also looking at healthcare now, or more towards healthcare now. Then you got Kimberly Clark's, General Electrics, Novartis, and MIT. So this kind of immediately indicates the trends, right? What the next slide is what type of products, what type of healthcare industry products are being protected? Where is the attention going? And this is the classification. So you'll find that a lot of it is diagnostic purposes. That's the first one. So measuring for diagnostic purpose, this is to identify whether is there anything wrong with you, where diagnosis is done. Then you have digital computing or data processing equipment or methods. And this is where perhaps the earlier players, Samsung and LG, came about, because all of this equipment, medical care equipment, also will have softwares integrated to them. All these medical equipments will have electronic devices, which then needs to be manufactured by electronic company in that arena. Then you got measuring and testing processes, medicinal preparations, antibodies. So all of this is very much COVID and the pandemic related. So this is why these are all on the rise, on the upwards trend. Then you got mixtures of active ingredients, and anti-oplastic agents, and medicinal preparations containing antigens and antibodies. So you can see where the trend is and what type of patents are being obtained. Our research also shows what are they relying on? What is the healthcare industry relying on in terms of protection? How are they carving out a market share and staying ahead of competitors? They are relying on patents. So patents is the top sought protection. And that's actually very natural, because if it is something related to function of the product, or it's solving a technical problem, patents is the best right to obtain. Patents is the widest protection that one can get when it comes to medical devices, when it comes to pharmaceutical products, when it comes to anything that is solving a problem that the market needs. So that brings me to an end. And the takeaway that I'd like to leave you with is IP and healthcare. The main trend that you can see from the presentation and the sharing I gave earlier is that we're finding healthcare being a very traditional industry being quickly merged with digital. So that's where you have bioinformatics rising, everyone trying to put IoT into a healthcare or medical wearable device, and a lot of diagnostics happening with IT element in it. So that brings me to the end of the session, and I will pass it back to you, Ashley.
Thank you, Gita. It is insightful sharing, because from your sharing, now that we know that it is very important to patent our products, and also not only on the health equipment. I think for the supplements also they can do patent and trademark as well, right, Gita? All right. Without further ado, I would like to invite Mr. Christopher, the third speaker for today, to talk about digital marketing strategies and the best practices for the healthcare industry.
Thanks, Ashley. Good to be back again after some time. Now after the MCO, we've been also pacing out the Survivor is Profit series. But today we are more focused on talking about the healthcare sector, and I'm quite impressed in terms of the data that is shown through Tara's deck just now. I'm also one of those who are the majority now, 59%, if I'm not mistaken, 59% of people are trying to set up their own gyms at home and all. I think there is quite a number of people who are consumers are spending more time online. That's definitely more time at home, right? And now we rely a lot on the delivery services to e-commerce to enable us to buy online without going out to line up or to scan the codes and to wear masks and to be very careful and to social distance ourselves. I think there's still a huge fear among all of us about this COVID-19. And that is the new norm now. People are sourcing online, people are buying online and getting products and services delivered to their household. And because of that, I think nowadays, looking at the statistics and the data that we've been analyzing for quite some time, the focus now is more on retention-based type of digital marketing strategy. So it's not so much on just acquiring new clients, because everybody is doing that. Everybody is trying to make noise in the market, trying to promote their products, even whether you're legitimate or illegitimate product branding, also you come out and trying to take this piece of the cake. And it's a no-brainer. A lot of people who were from the different industry suddenly want to jump into healthcare as well. So let's say if you're just a chemical supplier or chemical manufacturer, suddenly now you saw, oh, there's opportunity to do sanitizers. Let's jump into that as well. Or you could be from a fashion or clothing industry, and then suddenly people are jumping into masks, providing masks and all. So all this is happening now, and to be able to gauge the market properly, I think data shows that it's better that we focus on retention rather than just focusing on the acquisition. But having said that, acquisition is still important, but we can do it in a multiple manner, which is we still want to be getting people to aware of the brands or the products or the service or the equipment and so forth, right? And when we drive people down the funnel to consideration and to purchase, we can also work in terms of building up the customer relationships. And we can also be able to nurture our existing clients who already bought something or some service from us, to be able to work with them and to be able to guide them through, educate them, nurture them, and build long-term relationships with patients or our products customers. And research has shown that if we focus on retention, we can get like a loyal customer base, a loyal patient and customer base, and it costs businesses anywhere up to 5 to 25 times of more cost to acquire a new client rather than to retain an existing one. So by boosting the retention rate, we can, like, let's say if you can boost like 5% of your retention rate, then you are able to actually increase your profit margins to 25% at least. So it makes more sense to work with your existing clients who already know your brand or know your product, and later on transform them to your raving fans to be able to get new clients for your brand. So, and that should be, the hourglass funnel that we're talking about: customer relationship, retention, and creating awareness and providing holistic experience for your patients or your healthcare customers. And throughout the funnel, you have to look at that, right? Let's say if you have new products coming out, or if you have specific supplements that you want to promote, you can actually work your way through your existing customers first, people or clients who bought something else from you, And from there, you nurture those leads, you nurture those awareness campaigns. So it could be a better strategy if we do that. And there's a lot of stats to show that retention programs for healthcare nowadays is moving into a stronger position. And to be able to retain clients and to grow your client base through retention methods, you need to understand the customer's buying journey first as well. So let's say example, like if you were to pick one of your clients, right, and you understand where they go to, how is their buying journey like nowadays compared to before MCO. Probably they buy your products through pharmacies or through your flagship stores, right? And now maybe they move more towards e-commerce and they buy online, right? So you have to understand where they are. And one example is like through that whole funnel, you can notice that awareness, consideration, purchase, and retention, that whole funnel, right? You have to know and see how their journey is about. So let's say example, this lady here, all right, she read an article, a sponsored content when she was doing her research in skincare during RMCO, right? And later on, she clicked into one of the sponsored article and landed into the particular website and the company's website. And then she was browsing through. Then later on, she's retargeted in all the social media platforms, right? Whenever she popped into Instagram or YouTube or Facebook, you can see that the brand is reminding her, right? And then she comes in, she read and review the products or the services of the company from the website, and she visits the store, probably want to make a purchase, and then later on after making the purchase, then this retention program will come already. Like you'll be receiving like mixed contents, like newsletters, promotions, educational content that can help improve her life, right? In terms of the health sector. So that is one part of a journey that you need to understand, and whether you have touch point in all this, the whole journey. And when you look at the entire ecosphere, we do see that in the healthcare sector, there's a lot of email marketing that's going on. And because of that, they get to nurture those client base, right? And social media marketing is one of the main platforms that people use nowadays. It could be display ads, could be search, could be videos, brand awareness, it could be, lead gen or remarketing. And ultimately, you need to have data, right, to be able to analyze where are these people coming from and where they are moving along. How is their buyer's journey like? And we do see also the digital health platforms, like you see medication delivery. We have like the telehealth consulting, like just now Tara pointed out during one of her last slides, that there's a rise in terms of tele consulting in terms of health consultation through telephones. And that could be also one of the new trends that are coming up as well. So content marketing is still the key, right? To be able to publish like quality content that is, relevant and valuable to those people who are in your patients or the customers, your community, right? And not just to educate them, but to establish that and your brand or your products, to establish some sort of a trusted, that they have a brand value, that they understand, that they trust you, they know you as a brand that's trustworthy. So that is one part of digital marketing that you can look at. And like some examples of content marketing, right? You can talk about like how to help people cope with the new norm, right? And there's also contents like in Vietnam, okay, we also see that there's a lot of this sort of content on helping people how to check your health, what are the best practices, some myths buster or some facts about health knowledge and all. So it is also quite widely consumed, and we can see a huge demand in terms of all this information nowadays. And it's all about the funnel, right? So how many people are aware and aware of your brand, whether you are trustworthy, whether you are reliable enough. And when they go down the funnel, can you convert them to your loyal customers who will bring in new clients for you? So that should be that model nowadays. And I'll give you an example. Like let's say in the awareness stage, so you can create like teaser ads, or you can create content that is challenging to the market, like say, hey, is your hand sanitizer safe? Right? There's so many of these false or fake products nowadays, right? Everybody's just jumping into this bandwagon, trying to be a certified healthcare provider or a health products manufacturer, and whether is are they safe or not. So people need to be aware. Hey, are they safe or not? And people are curious. Am I using the safe products? And then later on, when they are in the consideration stage, then you can educate them. What are the results if you use unsafe hand sanitizers? What are the symptoms? And later on, when you also have to provide them with the opportunity to purchase, like how do they buy from a reliable source? Where can they get it? And is it very easy for them to just one click of the button, buy now, and go to your e-commerce platform where you can sell it to them, right? And later on, after purchasing from you, can they stay loyal can you nurture them? Can you educate them further into understanding more and more of this knowledge in terms of the health care sector, right? So one of the example that I want to pull out is one of our clients, Gitron. So they are a baby products and medical supplier, from beds to all sorts equipment, medical equipment and all. So very specific target audience that they want to. It has to be, let's say, like hospital management to medical practitioners, healthcare practitioners and all. So so they wanted to be able to generate leads and to increase sales, obviously. So we help them strategize and to run like educational ads, shopping ads on Google for their product targeting. And we do it like a hyper locally. So let's say different states have some specific messages, and we try to tailor it to their audience as well. They have different spots of audiences that they wanted to target. And it was a great result. They have 3x their sales during a very short campaign time. And from there, now they continue to educate the market to be able to nurture those clients that they already acquired, and to be able to move these clients towards being more and more, what you call that, brand loyal to them, right? So that is one of the ways that we help Chitron to do it. And today, more importantly, is we are able to help you design your action plan. And we hope that you can fill up this worksheet, which is also, we were working with Tara's team, Google, and also Gita's team as well. And we have a team of digital marketers, certified digital marketers, who are able to help you and to be able to be on call and to consult you. So this is free, no problem for us. We want to give some value to the SME market and to be able to help you all work out some action plans. And if you can fill out this worksheet, it will be very easy for you. So there's just a simple, let's say, some of your particulars and all, and there will be some simple questionnaire, so we know the direction that you want to move towards. And if you also need to, we can also do like a digital audit for you, so to understand where you stand and to identify certain gaps that you have in your whole digital assets or in your digital marketing plans. So we are able to later on, customize or to able to consult you further and to help you design those plans. And hopefully later on, you can be aware of what are the available channels, available tools out there that don't require a huge budget, that you can actually, do some sort of this retention-focused, retention-based digital marketing. So, well, we're ready for your Q&A. I see a lot of people are throwing in the questions already. Yep. So, yeah, back to you, Ashley.
Thank you, Christopher, and thank you for all the speakers for sharing. Okay, to recap what Christopher has mentioned about the worksheet, also for the benefits of the audience, by filling out this worksheet, we will be able to know how we can assist you better on your business. Again, you will get a digital audit and a shifter of the special insights for those who already have a Google campaign, and those who have not, there will be a starter kit guide in the shifter for you. Okay, so without further ado, let's move to the Q&A session. I hope all the speakers are ready to get the questions from the audience.
Yes,
Okay,
excited to do so.
let me pull out the first question. Okay, this question is from Yuan. What is the best or most suitable platform for me to promote or market my health equipment? Example, hospital bed. I believe this question will be to Chris.
Now, okay. Yuan, to answer your question is, I think there is no best platform. There's just many options there. Right? It really depends on the audience that you want to target and what stage are they in the funnel, right? Are they in the awareness stage? Are they already aware of your brand? Or are they in the consideration stage, or are they in the purchase stage? Where are they first? Then we can consider the channels that is available. But let's say, example, you said hospital bed, right? The question is hospital bed. Probably it will be like Gitron, one of our clients, the target audience will be the hospital management to medical management, medical practitioners to the healthcare practitioners and all. So if it's those people, they are also using social media, they are also sourcing for things. But if you ask me, intent-driven type of queries is always conversion is always better, right? So if you're focusing on to promote and to see faster results in terms of sales or inquiries, then intent-driven platforms are always better. Like example, like Google, right? If you the I'm sure when people are searching for what hospital bed to choose, or if there is a need now, or I need to change my whole hospital's bed because we are building a new division, a department, or a new section, then they will do their research and all. And when they do that research, these are very valuable leads. These are people who are already have the intent and they are already in the consideration to purchase stage. So these are good to have as well. And that I will recommend Google. But if you say you want your brand to be able to show strength or to be trustworthy or to be known to the market that you are reliable, then you have to do a lot of content marketing through various platforms. Social media could be one good one. YouTube is nowadays, I would strongly recommend YouTube because it's the number one TV channel in the whole Malaysia now, and everybody is doing MCO, and after MCO everybody is in YouTube now. So it is it would be great that you can educate the market about your products or your health equipments through video marketing, through YouTube and all. And the best part is you can put in the in-market people, which is those people who are already watching certain content about health, how to improve their health and all. So that you can match this kind of audiences to your whole digital marketing plan. Yeah, I hope I answer your question, Mr. Yuan.
All right, let's move on to the next question. This is from Andrea Ng. Is it a must to patent my product? What are the risks? This is, I think, for Gita.
Thanks, Andrea, for the question. So, it, not all products can be patented. Patent is only for products that are new and inventive and industrially applicable. So, Andrea, so it goes back to actually what is your product? If it's an existing technology, it's not new, or it's not inventive, that means it doesn't have any inventive element in it, then it might not even be patentable. If it can be patented, then yes, it's ideal because of copycats. If your product is going to be selling really well, the first thing that happens is there'll be imitation in the marketplace or counterfeit products. And that is the risk. The risk that you might do as much marketing, you might do as much as digital marketing, you might be yelling to the whole world that this is my brand, this is my product, this is an amazing healthcare device. But very, very quickly, you have another healthcare device, brand X, copying exactly what you do. So if you can, if it's patentable, then yes, you should get it because that risk is that it gives you exclusive rights. So both Tara and Chris are the parties to speak to scream out to people so that you kind of drive traffic in your direction. But where IP comes into play is you having a fence around your product to make sure people don't copy it. So that's where patent comes in. Patent is for the technology of your product, but your product will also have a brand. So Google is a brand for Google, it's a search engine, and Trinity 42 is a brand for the digital marketing agency, right? So
Mhm.
you're looking at patent being protecting your technology and brands protecting the name of your product. You can't have competitors using your registered trademark to search for products similar to yours.
This is from Sok Ching. If the product is patented in other countries but not in Malaysia and I'm selling it here, will my business get affected, Miss Gita?
Thanks for the question, Shukching. So if the product is patented in other countries and is not in Malaysia and you're selling it here, you actually are in that loophole, which is a good loophole to be in because intellectual property rights are country by country. So if the product, for example, is patented in the US, so it's protected in the US, but you see, hey, this technology will be very much performing well in Malaysia, and you start selling it in Malaysia. And if that owner of that technology has not protected it in Malaysia, that means that you have all the rights to use that without any risk of being sued. So because it's country specific. Now the disadvantage with that is that, and that goes to your will your business be affected, is that because it's already out there and it's been protected, you cannot go to the intellectual property office in Malaysia and protect it and get exclusive rights because it's no longer new. That technology is already out there. So if it's no longer new, yes, your business will get affected because yes, you put it out here in Malaysia, even though you don't need the rights from that American company. Everyone else, your competitors, will see that you're doing really well, and hey, you're stealing my clients because you're selling this new product, but they can start selling the same product as well, and you cannot stop them because it's not yours to begin with. I hope that explains it.
Yeah.
So Gita, if let's say the US company, the original brand trademark owner comes to Malaysia and patent it, then
That's it.
and
So so yes, if and they can't. So with patents with technology, you only can do that within 12 months. You can't, if they've been selling it for 5 years, they cannot come to Malaysia now and say I want to patent it. It's very time sensitive.
I see.
And
All right.
it's likewise with local pharma companies and local healthcare companies also rush to us when they come up with new technology and new innovations because they know that if they don't protect it before they launch it in the market, they will lose the rights.
Right.
I
Understand.
see.
Okay.
Cool. Interesting to know that.
Very technical, can be very technical.
All right. This is from Yi Ling. What is the ideal budget to start advertisement online? This is definitely for Christopher.
Well, there's you can start small. It depends your target audience, your range, and what is the your campaign goals that you want to achieve. But nowadays, digital marketing is very, very flexible. It could be your time is just the budget. You are able to do a lot of content marketing yourself, email blasting. If you have a small database to work with, you can start immediately already. And if you really want to run ads, it's very flexible. You can tweak by day, you can tweak by time, by geographical coverage. There's so many options out there. So yeah, just speak to us, do that worksheet, and we can help you design your whole budget for the next 5 years. No problem.
This one. Andy Ng. How do the following platforms compare? Google, Facebook, and TikTok. I think this is for Christopher.
Well, it's very different. It's all different platforms, right? So within Google itself, there's already so many different platforms within Google. So I think um, based on that question itself, there's different audience in different platforms and different usage of the channel. So like a Google channel, let's say it's search or display or YouTube, it's for different specific reasons that you're there for. For Facebook, social media, you want to be able to be connected and stay connected with your friends, and you want to be able to know what's the latest stuff that is shared amongst your network and community. So it's kind of like very different. So we believe in Trinity 42 is to be able to focus on your own business and look at the holistic internet as a whole. And been working with Google for many years, and usually pairing with Google with all the other channels and then drive intent-driven type of conversion, because those are the Google clients that can help a lot in terms of your whole digital. But it depends on the stage as well. So, you know, like the AICP, so where you are first in the stage. So, yeah. So,
And if you like to dance, then choose TikTok, right?
yeah, TikTok, yeah, it's for the new, yeah, very well. My nephews and nieces who are 10 years old, 8 years old, and they are like TikTokers already. So,
That's
it's,
amazing.
yeah, and
Marketers to be.
yeah, and they are influencing their parents, who is like in their 40s and 30s, who are also doing TikTok. So we do see like Grab, Food Panda, and all moving into TikTok, right? Influencing the younger generation. So it depends on where what you want to achieve in your campaigns, and then you select those channels. But now feel free to work on the worksheet. We are available, and we can commit to you that if you were to fill in all the worksheet and all your goals that you need to achieve, we will be able to help you design an action plan within this week. Just give us a couple of days. We can help you design that with the help of Gita and all our other partners that's available.
With the
And
digital marketing, I will fail, but yes.
yes,
But yeah, it's so interesting. I think what you guys both shared, I'm learning. So thanks for sharing.
yeah, I think this is why one of the main reasons why Survivor is Profit series is created, is to help create this kind of platform to share among all of us. And then most important also is to take care of each other. In Malaysia, we say this hashtag kita support kita, which is we support locally, we support ourselves. You know, together we can win the pandemic. So I think a lot of us needs to stick together and utilize and leverage with each other's resources and network to be able to move forward and to be able to pivot through our and transform our business towards the new market and new horizon.
Yeah,
Right.
so interesting. All right, let's not delay further. Okay, thank you for all the questions. Please remember to fill in the worksheet and we will see how we can assist you better. All right. We're looking forward for our next session, which we will be announcing soon via our social media and newsletter. For now, I would like to say thank you again for accepting our invitation to be our speaker for today.
Thank
Thanks
you,
to
Tata,
you.
Yeah.
Gita. Thank you so much.
Thanks, Chris. Thanks, Ashley. And thanks
Yeah,
to the listeners.
thank you all for tuning in. Appreciate our Trinity clients from all over Malaysia. I'm sure some of you cannot tune in live today, so maybe you can reach out to us. We can, you know, our consultants and our account managers will can you continue to talk to you, right? If you need any help.
Yeah.
So
I see there is still some question in the comments. Perhaps
we will address it later. Yeah,
yeah,
we can
okay.
personally address it later. Yeah,
Yeah. All right.
we will talk to you personally.
All right. Okay.
Thank
Thank you
you. Thank
again
you.
and see
Thanks,
you.
everyone. Bye bye.
Thanks. Bye.